But my dad took his life when I was 20. I had to work through a lot of stuff with that, but of course he had a lot of problems. And it's a tough world to be in when you're exposed to that, and most people are exposed to that. So first off, ketones. I want you to look up a Dr. Brett Scher. He's a good friend of mine. He is world renowned on this, and he talks about metabolic therapy or ketogenic therapies for mental disorders for all ages. And it's really special. With the project he's working on is needs to be louder, it needs to be bigger, and it's going to. But we're at the cutting edge of this. But the science is concrete. The research goes back to 1940s, 1950s on mental health and ketones. Unbelievable research out there. So go Google that, look it all up. But how does our product relevant to that? Well, it helps with neurotransmitter balance, why the Navy SEALs wanted it. It helps with reducing stress, helps with energy. Think about if somebody's dealing with mental health, they're usually not a picture of health. So if they're not improving energy efficiency, when the brain gets older, it starts to gap, it uptakes energy less efficient. And so the brain slows down. Memory, this familiar memory loss, poor memory, all these things are a problem that people are dealing with. Well, then you have a mood problem. We have stresses. I get pissed at my wife sometimes. It's tough. But if I had all those other things and her and I are not in a good place, you can see how my mood would be way, way worse, right? I've had surgeries dealing with pain. Pain's a trigger. So what if we could have better mental efficiency, meaning just health to the brain, more movement. Movement is really important for mental health. What if we had more metabolic efficiency and you're getting energy properly, and then you could deal with these problems? And I highly recommend people dealing with mental problems work with a therapist. I do all the time. Every couple of weeks or every month, I see a therapist. Why? Because I want to be better, and they can help me be better. I also worked on meditation and all those other things, but none of them work very well without me feeling great physically. So you got to work on the inside and the outside and the emotional and maybe even the spiritual side all as one if you really want to see people get better on mental side of it, rather than just the talking or the drug. Sometimes the drug's necessary and the talking is usually necessary. So hope that helps with that. Ketones are really important for that side.